I'm Dania. I'm 19 years old and I'm a diabetic patient since I was 3 years old. I know exactly what it means to be a diabetic patient. And I know how diabetes patients are suffering with this disease. And because I know, I would like to talk with you about this disease.
So what's diabetes? Diabetes is a group of metabolic diseases in which the person has high blood glucose or high blood sugar, either because insulin production is inadequate or because the body cells do not respond properly to insulin, or both. In 2013, it was estimated that over 382 million people through the world had diabetes. And of course, that's a really big number. There are two main types of diabetes, type 1 diabetes and type 2 diabetes. Type 1 diabetes, which is the body does not produce insulin. Approximately, there's 10% of all diabetes cases are type 1. Type 2 diabetes, which the body does not produce enough insulin for proper function, or the body cells do not respond properly to insulin. Approximately, there is 90% of all cases of diabetes worldwide are this type. In this documentary, we are going to talk about type 2 diabetes. Some symptom of diabetes is too much thirst or hunger, peeing too often, weight losses, thirdness, change in vision, slow healing cuts, and skin itches a lot.
Type 2 diabetes develop over a long period of time. During this period of time, insulin resistance starts. This is where the insulin increasingly ineffective at managing the blood glucose level. As a result of this insulin resistance, the pancreas responds by producing greater and greater amount of insulin to try and achieve some degree of management of the blood glucose level. This, as I mentioned, occurs over a very long period of time. As this overproduction of insulin occurs over a very long period of time, the cells in the pancreas that produce insulin wear themselves out. So, by the time someone is told that they have type 2 diabetes, they have lost 50 to 70% of the cells that produce insulin. This is mean that type 2 diabetes is a combination of ineffective insulin and not enough insulin. Type 2 diabetes is a progressive condition, and the progression is with the ongoing destruction of the cell in the pancreas that produce insulin. So, type 2 diabetes occurs when the body doesn't produce enough insulin to function properly, or the body cells do not react to insulin. This is shown in this picture. On the right of the picture, in this picture, it's showing that the beta cells in the pancreas cannot produce enough insulin. And on the left of this picture, it's shown that the cells in our bodies cannot react with the insulin. So what's caused diabetes type 2? First of all, weight. Being overweight is a primary risk factor of type 2 diabetes. The more fatty you have, the most resistant your cell become to insulin. Second, inactivity. The less activity you are, the greater your risk of type 2 diabetes. Physical activity helps you control your weight, use up glucose as energy, and make your cells more sensitive to insulin. Third, family history. The risk of type 2 diabetes increases if your parent or sibling has type 2 diabetes. Last, age. The risk of type 2 diabetes increases as you get older, especially after age 45. That's probably because people tend to exercise less, lose molecular masses, and gain weight as they become aged. Type 2 diabetes can often initially be managed with healthy eating and regular physical activity. However, over the time, most people with type 2 diabetes will also need tablets and many will also need insulin. It's important to note that this is just the natural progress of the condition, and taking tablet or insulin as soon as they are required can result in fewer complications in the long term.
Competition with no goal, that's so boring. I'll never eat a burger if it's not charbroiled.
And now, Big Hardy, new from Hardee's, the ultimate charboiled base.
Big Hardy. Double the fun of grilled on flames.
Big Hardy, the thrill of charboiling.
Unfortunately, all fast food and restaurant advertisement have greatly increased on television and social media. These advertisements are really attractive and make people who watch it influenced by it and make them always go to eat in those unhealthy restaurants. This will cause eat many carbohydrates that turn into sugar, and therefore this will cause a rise in cholesterol and blood sugar level, and this person who deals with a lot of fast food will develop diabetes. Nowadays technology such as TV and mobile phones and laptops are greatly facilitated communication, influence people and attractive them, so it can be easily to order from any restaurant, from any fast food restaurant, which can save people time. Like they thought that it saved their time, but actually it's destroyed their life and their health. And they think that there is no need to move from place to place to meet people or to finish few things or to do any work because of those technology. So that what make people more laziness and less movement, and this is turn lead to diabetes because there is no movement. According to Dr. Bana, more sugar was corrected with more diabetes. For every additional 150 calories of sugar available per person per day, the prevalence of diabetes in the population rose 1%. Even after controlling for obesity, physical activity, or other type of calories and number of economic and social variables. That's so sad because our food nowadays is full of calories and sugar. People get too lazy to cook their food by their own. They always order unhealthy food or buy their food from outside, which is full of carbohydrate and sugar. Nowadays, lifestyle is changed a lot and it became unhealthy lifestyle, which led us to get diabetes and other many dangerous diseases. According to these dangerous issues and this dangerous lifestyle, we make an interview with Dr. Muhammad Khalid, endocrinolog doctor.
How has the fast food and less of physical activity affected the number of diabetic patients?
Because of the fast food and lack of physical activity, the incidence of diabetes has increased. It has been known that if a person goes for a healthy lifestyle and proper diet, with good exercise, he can prolong, the onset of diabetes. So it is helpful if you can go for a good diet and exercise.
Control their diabetes?
Yes, if they follow a healthy lifestyle and good exercise and avoid fast foods, plus comply with the medications, take regular medications as prescribed by the doctors, and have a regular follow up, they can prevent long term complications, especially the eye, the heart, the kidney, and also the arteries of the legs. They can prevent these common complications.
Unfortunately, most people do not realize the dangers of neglecting their health and following unhealthy lifestyle. This can lead them easily to get diabetes, and diabetes is not an easy disease. It's a dangerous disease if you didn't control your blood sugar level. Diabetes can cause serious long-term health problems. It's the most common cause of vision losses and blindness in people of work age. Diabetes is also responsible of most cases of kidney failure and lower limb ampulation. People with diabetes are up to 5 times more likely to have cardiovascular diseases such as stroke than those without diabetes. God gave us this life. We have to feel thankful for that. We have to maintain our life by following healthy lifestyle and exercising and eat healthy food to avoid any dangerous diseases like diabetes, which might destroy